Hi, I'm Sam Lishtak with Absolute EHS, and I'm here today with Yael Saar, who's the founder of Mama's Comfort Camp. We did a chat about 8 months ago, and I'm very excited to have you back. So, hi, Yael. How are you?
Hi, Samantha. It's so good to be with you again. I'm all right. I am very, very tired of the pandemic. Some days I'm feeling like I'm not okay at all, but today is a relatively okay day.
That's good. Yeah, we're all getting a lot of pandemic fatigue, especially with the
So
weather.
tired.
Yeah.
Yeah. I'm home with two boys, a 16-year, well, no, he's about to turn 17 next week, and a 12-year-old who, I mean, he just turned 12 on Thanksgiving, and they're homeschooling. I mean, they're remote schooling from Ithaca High School and Boynton Middle School, and I'm surrounded by my favorite people in the whole world 24/7 for 9 months. And that's hard. And I used to work from home while they were all at school and work. My husband is a Cornell professor, and now that we're all at home all the time, it's like my nervous system is so done with being constantly surrounded. I am not used to never being alone, and I am a friendly and gregarious person, and I never would have imagined how much I would miss being alone and not hearing people and not having to think about feeding them all the time.
This is the unique type of fatigue that people who share households are in.
Yeah. Oh my God, I love you. Can you go away?
Stop touching me.
Yeah. Well, at this point, they're not, they're old enough to not want that. And in a way, I would prefer to have them touch me, but just stop talking to me and stop asking me for things.
That's fair. Mine's 3.5.
Yeah,
So
yeah, no, and my heart goes out and I bow at the feet of anyone who's at home with babies and toddlers right now.
we're managing.
Yeah.
Lots of Legos.
Hmm. Yeah. So, Sam, before we go into, I'm here because I have a ton of questions that are just very practical questions. I'm curious as to whether the things that I do to protect my family regarding shopping and playing outdoors and those sort of things, am I still doing the things that I need to be doing? And I would love to not be doing things I don't have to do because there's so much extra work and I'm tired. I'm exhausted. So I have a bunch of like practical questions like that I'm so grateful that you're willing to answer in a way that we can share with anyone else who might be asking the same questions. I don't think I'm that special, so I have no doubt that this will be useful for other moms, Mama's Comfort Camp moms, and moms everywhere. But before you start answering the questions, can you share a little bit about what is it that you do and why should we be listening to you?
Sure. So I'm the owner of Absolute EHS, which stands for Environmental Health and Safety. I have been doing environmental health and safety work for well over 10 years now, which is very exciting. I'm a certified safety professional with the Board of Certified Safety Professionals. I'm a certified instructional trainer. I am an American Heart Association instructor. I am an ASHI training center, so that's CPR and first aid training. I was recently asked by the American Red Cross to become an instructor with them, so that's the newest thing. Yes.
Awesome.
And of note, I am the very first ever knowledge, skills, abilities Grand Master per the Board of Certified Safety Professionals, which basically evaluates your knowledge in all 27 subtopics of environmental health and safety. And I was the first one to pass them all.
Oh my
So
God. And here you are also in my life. I know you as one of the den mothers who are the moderators at Mama's Comfort Camp. It's a group of volunteers that help support our wonderful and unique safe space in our Facebook group. And so have a lot of I love watching how your brain works when you analyze questions, and I always love to see like your process and your reasoning. So it doesn't surprise me that you were the first to pass that because your brain is just so sharp and so keen, and you care so much. So that's wonderful.
well, thank you.
Congratulations.
Thank you. Yeah, and being a moderator for MCC, it's worth noting that if anybody listening wants to be a part of Mama's Comfort Camp or know what we're talking about, there is an international as well as a local Ithaca chapter. So just look us up on Facebook and say hi.
Yeah, it's free, will always be free. It's for moms of kids of all ages and stages. So we have like brand new moms and grandmothers and moms of teens like me and every stage and age in between. So everybody's welcome.
And it's fun to moderate too. So
Yeah, isn't it cool? Like the moderation ends up being a really, it's an unexpected, fabulous aspect. And it attracts the most amazing women like you. So shout out to the Den Mamas. You're the best.
yay, Den Mamas. All right, so Yael, what have you got for me?
Well, first of all, I would really like to understand more about what you do in the community. What
Oh,
what is your work and who when should like how should we be listening to you more so we're more protected?
well, obviously, I've been doing a lot of work with COVID. I volunteered to help GEOC, the Greater Ithaca Activity Center, with their reopening plans, and I did two actually in-person outside COVID trainings for their faculty and staff. I also helped with the Alex Haley Pool reopening protocol,
Hmm.
also voluntarily. What else have I done? Done very minor work with the health department, but mostly I've been working with small local businesses, such as our wonderful local Tall Oren Cohen, who is also part of MCC. So her commercial kitchen has been covered by a protocol that I wrote. We've got some other local essential services and mom and pop shops and uh,
Hmm.
home inspectors who all have COVID plans. But what people are realizing now is they also need ergonomic evaluations, which I do, and I can do those remotely. Businesses are starting up again, and a lot of them need fire inspections, which are things I can do, audits. So either chemical and commercial audits or just management system auditing or management system implication. I can do that, and I do that as well. I'm actually mostly known for emergency response training. So on the East Coast, we call it HAZWOPER training, which is hazardous waste operations.
Hmm.
And this is something that usually large factories or manufacturers have on site. So it's training your own staff to be trained in first aid and CPR, to know how to clean up XYZ chemical spill, how to dispose of it properly so that you're compliant with RCRA and EPA
Hmm.
protocols. In California, they have slightly different names, but there are other regulations. So I teach the California version of HAZWOPER as well as the federal version of HAZWOPER. And I write emergency action plans. So what do you do in case of a fire, in case of an active threat? How do you train your staff? What's your protocol for your facility? How do you notify local law enforcement or 211 type help? So it's a
Hmm.
large breadth of things that I can help out with.
Yeah. So like the school, like I wish the school district would work with you on, there's so much there that you could help them with.
I used to work for schools. I actually was the environmental life safety supervisor for Colorado Springs School District 11, which was kindergarten through 12. And I actually started my career in safety working in the City University of New York,
Hmm.
doing chemical safety management in the psychology and the chemistry labs. So I'm here if the schools need me, but I think the health department's been helping them out a lot. And the health department also knows what they're doing.
Oh, absolutely. And next week we're going to be talking with Samantha Hilson from the health department, which is also in the Mama's Comfort Camp moderation team and a board member of Mama's Comfort Camp. So I can't wait for that conversation too.
Yeah, I'm excited to talk to her. We're going to need
Yeah,
nicknames though, otherwise it's going to be confusing.
right. One, yeah, two Sams. Um, okay, so can I jump into my questions?
Go ahead.
Okay, so let's talk about bringing things from outside the home into the home. And most of those things are groceries. And some of those things would be like sweatpants, because that's all we wear anymore. Um, so for those of us who are privileged enough to be able to use curbside pickup.
Mhm.
We don't handle the items until we literally bring them in the door.
Mhm.
So, my understanding about how to handle stuff, whether it's food, which I would like to divide to things that need to be stored in room temperature and things that need to be stored in the fridge or the freezer. What we have been doing throughout this period is the stuff that can be stored in room temperature just stays in the brown bags for 2, 3, 4 days. We just don't touch it, assuming that the virus dies on the surfaces.
Mhm.
And stuff that needs to go in the fridge, where supposedly where I'm imagining that and the freezer where the virus can last longer until and become viable once it warms up again, once it comes out of the fridge or the freezer, and I could potentially touch the package and then touch my mouth. Um, so we have been disinfecting our milk cartons and our hummus boxes using either a disinfectant wipe or more often just making a bleach solution and dipping a rag in that and wiping all of the things that end up in the freezer and the refrigerator before they go in. So usually when we get the groceries, there's this like, okay, now I'm going to have to take a good half hour of my time to just make sure that all the things that are not refrigerated are in their own in like one space in their own bags, and all the things that need to be refrigerated, I like clean them up as best I can, one after the other, and and then I put them in the refrigerator, and then sometimes I even like disinfect the fridge if like I think somebody put something in before it was disinfected.
Right.
So is this overkill? Please tell me it's overkill.
I'm going to say it's going to depend on the comfort level and any comorbidities or I hate to use the word issues, but things of concern going on in the home. So last time we spoke, I believe what I said, and this is what I think I've been saying for a while, but we also spoke 8 months ago, is
Mm-hmm.
when we, well, we'll talk about being in the grocery store later, but when we pick up that carton of milk that that the person delivered, the chances of you actually touching the same spot that that person touched are fairly slim. And then add to that, what are the chances that the person is COVID positive, which granted is higher than it was 8 months ago, particularly in Tompkins County. But what are the chances that the person at this point in time wasn't wearing a mask, decided to cough or sneeze onto their hand or onto your item, and then left enough of a wet viral spot, and then you happen to touch that same spot and then touch your own nose, eyes, or mouth. So if you take all that into consideration, your risk is fairly low. As we stated, again, this is 8 months ago, but as we talked about before, this is an aerosol transmissible. It always has been, and part of aerosol transmissible written programs is universal precautions and surface contamination. So yes, there is a surface contamination issue, but the risk of contracting COVID purely off of that carton of milk are extremely, extremely slim. It's very unlikely. I still don't think that anything's really been traced. A positive case has been traced to something like a carton of milk. Now, they have seen cartons of milk that do have live virus on them. They've seen frozen, I think it was frozen fish, I want to say in Japan, China.
China.
So we know that the virus can be alive, but none of those stories led to an actual transmission. So the amount,
And
yeah.
so I'm hearing you that there is an infinitesimal chance that viable virus on the surface of cold products might end up on our fingers and therefore in our mouth or our nose or eyes. And that could be a way for it to make us sick,
Mm-hmm.
but that there's hardly any evidence of this actually happening.
You would have to get enough of a viral load in your eye or up your nose for it to, let's say, be
And there's
worthwhile for the virus.
right, and there's just not enough. If say somebody who was sick sneezed on their hand, touched that carton of milk, whatever that would be is just likely to be so low. Like they would have to work at it. Like they would have to like rub their hands on their face and like rub them all over the carton of milk for any chance. Okay.
They would
So
have to
what
like hock a loogie on there, and then you would have to not only not see it, but pick up the whole loogie and shove it up your own nose.
interesting. Okay. So that makes me think then that like all of those hours that over the last 8 months that I used to disinfect in specific things were not the best use of my time. But also it makes me think of, there is a toxicity to bleach solution. There is a toxicity to disinfectant wipes. There is a toxicity to all of that, every time I touch something, using the chemical disinfectant like 7 times in 1 hour
Hmm.
in the store, maybe that's not necessary.
And that's part of why on the Absolute EHS YouTube channel, on the various podcasts, I've always been a huge proponent of soap and water. It does the exact same thing. I
Right.
come from chemical safety, so having a bunch of people who don't have access to gloves, who don't have proper ventilation, who don't know how to dilute these chemicals, there are definitely inherent risks with using this much bleach, especially around food items. I maintain, please do not use vinegar. Vinegar is not going to kill a virus. Let's just recap that.
Right.
But soap and water, it's cheap, it's affordable, it's easy accessible. You can use it, just rinse everything off really thoroughly. And that's what I have been using on our doorknobs. And that's what I will continue to use. Now, one thing I will say in terms of what I personally do is while I might not disinfect my groceries, what I do is I will put things um, away and make sure I don't touch them for about 24 hours. So I'll put them away and be comfortable with them in the cabinet, but I still don't really want to touch them. Particularly, I don't want my daughter touching them because I don't know if she's gonna, lick something or not wash her hands. I'll always wash my hands.
Right.
And I
So
still buy fruit that either comes in its own package, like a banana or an orange, or when I'm going for apples, I go for the pre-bagged ones
right.
because there's they haven't been handled in so long since they got bagged originally and then shipped
Right.
to the grocery store and then ended up in my house.
So
Just
24 hours is a good buffer.
for cardboard, that's what they were saying. And again, that's mostly because I have a toddler at home.
And
Um,
so we have been like giving things 2, 3, 4 days. That's more than necessary.
it the numbers change depending on what material is being used. So if it's
So
metal or
oranges,
plastic,
bananas.
yeah, it would be fine to just use those. And especially if you have adult children, just make sure they know to wash their hands
Right.
after handling packages. Um,
Hmm.
and, for those of us with smaller children, make sure the things that your kids are going to touch are washed. So I think even 8 months ago, I was using soap and water on all the apples and then throwing them in the fruit bowl because she would touch them.
Right.
Now I just buy the pre-bagged ones and I put them straight into the fruit bowl, if that gives
Hmm.
kind of a little clarity to how things are
Yeah,
evolving.
that does. Okay, that's really helpful. So my next question is also about shopping, and here it is about shopping in person.
Hmm.
So again, I am extremely grateful and aware of my privilege that I can avoid going into the store for grocery shopping. And I'm very grateful for the essential workers who bag and deliver and all of those things. Um, and for the work that they do. And I wish them all better hours and hazard pay and all that good stuff. Um, but when there are other things that is harder to get um, curbside pickup. So, for example, my kids are growing, they're getting taller by the minute, and their sweatpants are becoming too short for them. And even though nobody sees them, it's nice to have your ankles covered. So it's time to get new sweatpants for all involved, actually. Um, and I would prefer to go into Target, have me like whatever, when I want to buy sweatpants, I would want to try them on myself. But for my kids, they don't necessarily have to try them on in the store, but they can like see it, touch it, see if it feels good, soft or not, or that sort of thing. And I guess I could order the things, and they need one or two sweatpants. If I go into the store with them, we'll spend a half hour in the store and we'll be wearing our masks, and they will come out of there with the two sweatpants that they have chosen.
Right.
And if I'm ordering for pickup, I will probably end up ordering, 3 or 4 per person, and they'll end up keeping maybe one because they may not even, or zero because they may not like any of them. So again, totally feeling my privilege making my ears burn here, but I would prefer to just go into the store myself,
right,
and with a kid. My husband, who has asthma, feels very uncomfortable about that and really prefers that we don't. So,
there are a lot of aspects to the scenario that we're talking about. So yes, our essential workers, those in grocery stores and just stores that we need to go to and get essential items from, not only are we're, again, my privilege is speaking too, but it's the fewer people who go into these stores, the safer those essential employees are too. So in many respects, while it's cold and snowy and rainy and they have to walk out to cars, and that part kind of sucks, the more people who are able to do that type of thing can do that type of thing, it's actually it's exposing people who have to go into the store, who don't have the option to do a curbside, or the people who have to work for that paycheck. It's limiting the number of potential aerosol transmissibles in the air being recirculated. So if it is possible to do, this is just general, if
right.
it's possible to do the curbside, and the store you're purchasing from does have a return policy, because that's something a lot of stores have changed their return policies. If this is something that is an option for you, I would press you to do it, because which is to buy the 2 sizes, figure out the right size, and then go back and say, okay, we're going to give these back, and we're going to buy 5 of these because we know we like them. And the reason for that is the people who don't have that luxury, we're protected. This is a community transmissible disease, so we need to act as a community. And I, as a safety professional working in risk mitigation, don't know if now's the time to say, well, this is a privilege thing, I'm not going to do it. It's a privilege for everybody that you can do it. And it might sound kind of backwards to some people, but I really hope that they understand the sentiment behind it.
Well, I'm actually loving how you made me like think about it from a completely different angle, because I didn't think about it from that perspective. I was just thinking that I'm being like wasteful of other people's time by making them have to bring me more and have me then return it. And also I was just thinking about, well, we like to choose our things ourselves, right? We like to go into the stores, and how bad is it if we go in for 20 minutes? But what you're telling me is actually every time I step foot into a store, I'm actually endangering the people who work there, and they don't have a choice. They are there. So the fewer of me choosing to go in because I like it, because I miss my Target hour, right? Like I used to be as a mom, a stay-at-home mom, working from home mom, the 1 hour a week I would normally spend at Target was actually some kind of a weird, not that inspiring me time, right?
I miss shopping. I miss just like walking up and down the aisle and looking.
Exactly. So, but right now, the reason not to do that is not because my asthma dealing with husband would prefer that I don't. Although, that's a good idea. That's a good, he has a good point, but he's probably not going to end up sick because I went into the store for 20 minutes. But the fewer people go into the store for 20 minutes, the healthier the store workers will be.
Correct. Now, I'm sure there are many people with small stores who are very upset that I'm saying this right now.
Hmm.
So for those small, we'll call them mom and pop shops, particularly the brick and mortars, this is a great time to call ahead and have a plan. So when I needed one thing, for example, and for whatever reason it's not available for curbside pickup, either because it's a heavy item or a dangerous item or
Hmm.
dangerous because it's lamp oil and they're not supposed to handle it or whatever the case may be, I will call ahead, make sure it's in stock, ask on the phone what aisle it's in, and beeline straight there and then check out. Lucky for me, I've only had to do that a handful of times over the year. But you want to keep, the general goal would be to keep your time inside that store to under 15 minutes, if at all possible. 15 minutes is picked because that's the CDC guideline for exposure to positive COVID cases. And you do need to assume that there will be a positive COVID case within that building. Whether or not you get contact traced or it's reported is a different story. But
Hmm.
we need to assume, particularly when we go into those really large stores with circulating air, particularly stores where people like to browse, you need to assume that it's
Right.
in the air.
Okay. So, for example, last week we realized that all of our sleds, we had two sleds and they were broken.
Yeah.
And two boys, and they want to go sledding, and we're going to talk about outdoor play, winter outdoor play in a minute. But we needed sleds, and the only place where was, I asked in Mama's Comfort Camp, where are the sleds? And people said, well, at Ollie's.
Mhm.
And at Ollie's, in the past, they used to put them outside the store.
Yeah.
And now they were just inside the store, like you could see it from the doorway.
Mhm.
And I went in, I picked up a couple of blue sleds, and went to pay for them. But like I also could use a couple of other home items, like we go through our kitchen towels much faster now. I could have used it to buy a few, but mostly because of my husband's sensitivity right now, I did not give myself, a half hour browsing the cute towels that they have at Ollie's, because I wanted to keep my visit there for under 10 minutes. So I walked in, I saw the things, I inspected them for cracks, and went straight to the cash register.
And that's perfect. And that's what I would call kind of a specialty item. It's hard to find. Something
Right.
like kitchen towels, you can turn to a gift economy or do drive up. Or if you know that you need a couple of things from any store, you could usually call ahead because they have to give you some sort of reasonable accommodation. If you do have someone high risk at home, they would be able to run it out. You can pay for it over the phone. Um,
Right. Or,
I
for
did,
example, we love some of the items at the Korean store, and there I have, next time I go, I plan on calling the store, asking the proprietor, who knows me by now after years of us shopping there. Just I probably will just it probably will be something that she would be happy to do. So I just need to ask her if that's okay.
and the thing is, the worst thing that happens is they say no.
Right. There's no
Right? And
downside
if
to
that's the
asking.
case, you just make your list, try to have a plan, and get in and out as quickly as possible. It's not to
So
say
the
don't go, it's to say be smart with your time.
Right. So 15 minutes should be okay. If you can keep it to 10, even better.
Of course, yeah.
Yeah.
So in particularly in risk management, we like to say whatever the legal upper limit, you want to be about half of that. So ideally 7.5 minutes if you can be
Hmm.
really quick. But 15 minutes is the quote unquote legal, suggested CDC limit that we're looking at here.
Right.
I
Um,
mentioned gift economies, and I just want to touch on that really quickly.
sure.
Nobody's got money. Everybody's got stuff. We're all stuck at home with our stuff that we just can't be
Right.
around anymore. Gift economies are great, but it's going to be a little different than that Instacart picture that we just painted.
Right.
Because the item was in somebody's house. Um,
So let's just break it up. The gift economy are either websites or online forums where people ask for what they don't have, and or people list what they have too much of,
mhm.
and people exchange them for most often for free.
Right. And this also comes through mutual aid requests. Craigslist is a really good example. And
Right.
to kind of put that out there.
So used items that come from the home.
Correct. So the fact that they were in a home, arguably, just to paint a bad picture, drenched in the air from that home, and you
Hmm.
don't know where that air came from. If it is a cloth item, it goes straight into the wash if you need it for immediate use. But otherwise, I would quarantine those items outside of the home or in your garage or in your mudroom or just in an area where it's not touched. Honestly, I'd go for a week because you really don't know if somebody else's kid was just licking it before they gave it to you. You don't know if someone did hawk that disgusting loogie that we were talking about before.
Right, right.
If you can spare a week or even a couple of days, put it in a big garbage bag, put it in the corner of your bedroom and just let it sit there. That's going to
Right.
be a really good idea. If you can disinfect with soap and water, throw it in the washing machine, any of those things, that's going to be a really good move for you.
Okay.
So, and definitely wear your masks. If you've got gloves, go for it. But the mask
While you're handling the item.
While you're handling the item, yeah.
Okay, not just while you're receiving the item if you end up receiving
Right.
it from a person.
Yeah.
Okay, that's really good to know. That was in my blind spot. So back to the store.
Mhm.
Is there like most stores now have like a plexiglass or acetate barrier between the cashiers and you, which I know means nothing much. Is it correct?
No, that's not actually true. So that's what we call engineering controls, which is a specific physical stop for a safety
Mm-hmm.
hazard. So the idea with those plexiglass barriers is you would actually have to walk around it and deliberately ignore it or move it
Mm-hmm.
to get around it. And that's why engineering controls are better than personal protective equipment, which is masks and gloves, because those are easy to forget. Engineering
Mm-hmm.
controls come actually after administrative, which is the rules, for example, 6 foot distancing. Everybody seems to have a weird perception of what 6 feet looks like.
Mm-hmm.
Um, think of the person who's closest to 6 feet, and would that person's whole body length fit between you and another person? Um, so it goes personal protective equipment, which people need to be trained on, and many of us aren't. And you have to have readily accessible, which a lot of us still don't have PPE. The next one would be administrative controls, which is legal requirements, such as the 6 foot distancing. I like your mask. And then after that comes the engineering controls, which is something such as that plexiglass barrier.
Right.
Now, the plexiglass is not going to prevent aerosol transmission. The plexiglass prevents that surface contamination that we were just talking about. So
Mm-hmm.
if the shopper sneezes on the clerk or vice versa,
Mm-hmm.
it's going to get caught by the plexiglass.
Right. So mm, I have been told to not really, right, because it doesn't prevent aerosol transmission, to not really see it as something that protects me. But then I often see in stores, I see people who are just wearing face shields, those clear face shields that don't actually seal anything. I feel like a mask is so much safer. And if somebody wants to wear a face shield, it should be on top of the mask. And if I see someone in the store, especially if it's someone in the cash register, working the cash register, just wearing that, I don't go to them. Like I would not. I would walk out of the store without purchasing,
Absolutely.
or I would go to a different cash register. Is that appropriate?
Yeah, I do believe it is. So one of the fun things about being in safety for so many years and people kind of finally learning what we do is this isn't new. This face shield thing isn't new. OSHA and ACGIH, which is all the industrial hygienists who do air monitoring and personnel exposures, it's been a rule ever since face shields were a thing that you must wear a mask under it, particularly if we're talking about aerosols. So this is not new information, it's just new to the general public. So
But
I
it
love.
seems like store managers actually seem to allow their
Mhm.
employees just wear the face shield. So when I
And
see that, I'm a loudmouth, so sometimes I will actually ask to speak to a manager and say I don't feel protected and I will not shop here if I
and
see
not
and
to, to plug myself here, but that is one of the telltale signs that that store doesn't have a safety professional working with them.
right.
Any safety professional, any public health official, we all know this. So yes, if I see something like that, just a face shield, no mask, I will assume that that store has not been in touch with the health department to review their protocol, and has not talked to a safety professional, which usually means, because they do have to have, they are required by New York State to have those COVID-19 reopening plans, that nobody has read it or reviewed it, which is not, this should not be a shock to anybody. Those, Cuomo was very clear, those are legally have to be written, but will not be reviewed unless there is a reason to suspect an exposure in the store.
So people can arrange for one, but not ever read them, and therefore
Yep.
the customers and the employees don't get protected.
And this is why there's anonymous reporting. So I know it's call it being a tattletale, calling me whatever you want. The fact is, this is a public health crisis. You can anonymously submit concerns. It's not outing someone, it's concerns about either your own employer or a store that you go into, and just say, I don't know enough, or this doesn't seem right. Can someone just call? And it's just a phone call. It's not, nobody's going to get in trouble. It's, what we do. I used to say, I'm not a safety police officer. I'm here to help and inform, but I can't help and inform unless somebody says something to me.
Right.
So it's kind of like doing today's podcast. Unless the questions are asked, or unless somebody says something, it's just completely not on anybody's radar, especially considering how overwhelmed the health department is right now.
Right. Okay. So if I see something like that, like there's a store in town that I absolutely adore, and most of their employees wear masks. And then when I saw one that was just wearing face shields and was interacting with customers, I actually went to the customer service desk and I said, "It's making me uncomfortable.
Mm-hmm.
I want to come back here." And they were thankful.
And and that's the kind of that same type of argument as curbside pickup. I know my husband and I disagree on this a lot. Telling somebody that you as a customer are uncomfortable could very well be you saying the thing that's been on the employees' minds and they haven't been able to say to their manager.
Interesting. Okay, that's good to know. Okay, going back to food,
Yes.
we hardly do any takeout anymore because we're kind of uncomfortable. But there was just Christmas, and we're Jewish, and very often it's a
What kind of
tradition.
Chinese food did you
For,
get?
tasty that tasty hot pot.
Love that place.
It was so good, and so of course we disinfected all of the containers and stuff. I'm under the impression that we can't get COVID from eating the food inside of the container, as long as we swallow, and it ends up in our digestive system. We're not going to get COVID, even if somebody sneezed while they were making the fried rice.
That I can't necessarily speak to. I get very uncomfortable doing absolutes despite the name of my company.
Right. Okay.
So I'm not going to say you can't get COVID. What I will say is I have also not read any anecdotes where someone definitively got COVID from eating takeout. I know there have been concerns in quarantines, particularly over containers, or if the restaurant had COVID concerns and then somebody went to said restaurant during the shifts when that person was working. I know on my end, we tend to throw food back in the oven as soon as we get it, and take it
Oh,
out of the containers.
tell me more.
It's just, and again, it's because I have a kid and she, puts food on her hands and then sticks it in her eye and on her nose, or in our eyes and our nose. But there's still, as far as I know, only one company out here, which is Bali Cravings, that does have a specifically written COVID protocol for all food handling in the commercial kitchen, to include how the packaging is handled
Mm-hmm.
and how it's picked up. So that is the only thing I have no problem bringing directly into the house, putting in my kitchen and handing to my daughter. With everything else, particularly because, and I think we spoke about this before, if you use a delivery service, now you've got the people who are cooking the food,
Right.
who are not always the people who are packaging the food. And then those containers go to the person in the front who usually bagged the food. And
Yeah.
then it sits there waiting for the other company who may or may not have safety guidelines in place pick up that bag, put it in their car. You have no idea what was in their car, and then drop it off at your front door.
So when I bring that in, you would recommend doing what with the food containers? Opening them up, putting them onto a pan, or putting the container itself? Like, what would you do with the paper containers and with the plastic containers?
So what we used to do pre-COVID, what we used to do is bring the whole bag to the dining room table. Plates are out. You serve directly out of there. It doesn't matter where the bag is. It doesn't matter what's going on. At this point, what we do is everything in the bag would have been handled by the restaurant. Everything
Right.
outside of the bag is, I would say, slightly more questionable.
Mm-hmm.
So we bring it straight to the kitchen counter. We unload, throw away the bag, disinfect the counter where the bag was. And this may be overkill, especially in line with what we were just talking about with Instacart, but I personally feel too many people have handled everything. There
Yeah.
were too
Okay.
many faces too close to my food. Whereas in a grocery store, it tends to be a big pallet that is stocked
Yeah.
all at once, and there's far less interaction with
People
each
breathing on the
other.
containers.
Yeah. So what I do is the outside of the bag, as far as I'm concerned, is just unneeded risk. There's no reason to bring those extra 2 or more people in that car and
Right.
these germs into my house. So if I take the contents out of the bag, now I know for sure it's just the restaurant,
Yes.
as opposed to the restaurant and everything else that was in
And
that
Uber
person's
Eats or
car.
whatever that was.
Yeah, because I mean, again, there's nothing wrong with using all these food delivery companies, but you don't know the volume.
I send my 17-year-old to get it.
That's even better. So yeah, if you could do a curbside pickup,
Yeah.
also then more money goes to the restaurants, and our
Right.
restaurants are really struggling right now.
Yes.
So if you can call directly and pay them directly and then pick it
Yeah,
up
that's what
yourself,
we've been doing.
that's better for everybody. And if that's the case, then yeah, I would probably be very comfortable putting the food, wherever it needs to be. But yeah, I do tend to heat things up.
So if I'm ordering pizza, just I'm hearing you that like it might be a good idea to put the pizza in the oven for a few minutes.
That's what we do. Yeah.
But when it comes to like Chinese food in the paper containers or the plastic containers, if we just disinfect the containers, then we can put them on the dining room table and people can serve themselves onto their plates. Is that good enough? Or
Yes.
or should we like maybe put this in a plate and then put the plate in the microwave for a minute? Like, is that helpful at all?
I mean, I guess it could be, but again, it's one of those things where particularly, and we're talking about Chinese food. Chinese food tends to be stir fried in a wok, like things are heated to very high temperatures and then put directly into the containers. So that makes me a little less concerned. But something like pizza, which you also mentioned, is a big open surface, and they have
Mm-hmm.
to check it. They usually check it with their finger or visually, and then
Mm-hmm.
it goes in a box, and then it's just that box that's the package. So the
Mm-hmm.
pizza I generally put in the oven for a few minutes just to be extra careful. But
Yeah.
something that I know is fried, or very hot and then directly packaged, and this might just be because I happen to work in a couple of restaurants doing safety consulting.
Mm-hmm.
It's just the way that it's handled during that protocol. But I will also mention in this whole year, I will not eat salads.
Right.
Salads. I
No
think I
takeout
mentioned that
salad.
last time
Makes
too.
sense.
It's not cooked. You already have, and while it's vanishing chance, but we already know that E. coli is easily carried on certain lettuces, which is no fault of a restaurant. It's just how
Right.
it is. Do we really want to bring, knowing that that's a potential, having a fairly common bacteria, have enough of a load to make people sick?
Right.
Do we really want to open that can of worms? So again, it comes back to risk management.
So you're saying you're not getting salads from restaurants, but do you during this time, would you feel comfortable getting like, bagged salad from the grocery store, like lots of, if you wanted anything but for example, arugula or spinach, or those come
Yeah, and we buy it.
in bags, and then those are often considered triple washed and and okay to eat straight from the bag. I guess this is not necessarily a COVID question because the likelihood of there being COVID is very low, but is it safe to eat those things?
Yeah.
Unless there was a specific recall, I guess, which we've
Well, if there's a
seen.
recall, it's already too late.
Right. Okay. Because
So,
if there is a so because here's a question again, me and my husband, who is much more risk averse than I am, um, when he when he takes the spinach out of the box, he insists on washing it with water before making the salad with it.
mhm,
And I'm thinking, well, if this has E. coli on it, just washing it with water won't make a difference. It
mhm.
has already been triple washed. So I would prefer to eat my salad not soaking wet and just so, just put the dressing on it. Um, but or we just decide that we don't eat raw spinach and we make cream spinach, which I'm very happy to make.
Mhm.
Um,
It sounds
but
like you need a salad spinner.
that is true. We broke an old one.
Yeah, if so, COVID
But is
aside,
just washing with water going to make, if there's a problem with E. coli on leafy vegetables, is
mhm.
just washing it with water going to make it go away?
So if we're talking about a triple rinse type of pre-packaged leaf medley,
Mm-hmm.
um, the chances of having something like E. coli are pretty slim. Water has never hurt, but the thing is, those boxes still have vents. So I know I've found perfectly natural, bugs, or sometimes it's like sitting weird, and there's some bruised leaves that you don't catch until you're rinsing them. So I mean, this is just my personal habit. Usually the top layer I end up eating straight out because I know it's fairly fresh. I can see it. It looks good.
Mm-hmm.
I take it out. And then by the time I get to like the middle of the box, usually it's been like another day or so, or a day or two later, I'll usually rinse it just to make
Right.
sure like there's nothing gross on it. But
Right. But that's like gross detection and prevention,
yes.
which we do. Which
Yeah,
we, we,
that's
we
the 28th subset of EHS is the gross protection. And
yes.
but yeah,
Okay.
the triple rinse stuff, they have protocols that are in place that have been tried and true. And this is, outside of the COVID conversation. Yeah, their USDA is very strict about what they'll allow people to put
Got
on
it.
labels.
So my last question, it's a couple of questions, but they're all related to outdoor play.
Mhm.
So it's very cold in upstate New York right now, and but we have to get out of the house to see people. So my ability to see people these days kind of has three situations. Skiing and sledding
Mhm.
is well, I guess that's two situations, but it's like moving and everybody's wearing seven layers of things, and they're wearing a scarf and a balaclava which covers their face but is nowhere near as sealing as a mask.
Right.
And the kids are not necessarily, like, I mean, they're not sitting on top of each other. They can maintain 6 feet of distance between each other. So that feels pretty safe to me.
Mhm.
Then we have some friends that have a fire pit, and they've invited us to come over for drinks outside. We haven't actually gone yet, but that seems to me like a nice thing to do, as long as, so I'm like 6 to 8 feet apart. Is it okay to take off our masks to sip our hot cider?
Right. Okay, so let's start with the fire pit because that touches upon what we just moved out of season-wise too. So fire pits are great, especially if we can stay at least 6 feet apart. Now, we need to remember New York State says 6 feet or masks. The CDC says 6 feet and masks. So we're supposed to be 6 feet apart and wearing masks. There's an and in there that, for whatever
Got it.
reason, New York State does not want to acknowledge. Um, so I'm a big proponent of the and. If
Hmm.
you are eating or drinking, obviously you're not going to be wearing a mask. So this is where I tend to consult people and say, you're looking at 10+ feet if you're
Okay.
not wearing a mask. Um, you mentioned drinking and then clarified hot chocolate. Let's talk about alcohol for a minute though. Um, as I mentioned briefly before with administrative controls, which are things like that 6 foot law um,
Hmm.
or guidance, administrative controls can be subject to altered perceptions, such as how far is 6 feet. So the more we drink, the closer we tend to edge, or those who might normally not hug each other because we know we're in a pandemic, you have a couple of beers and you go, oh, what's one hug? And that's that tends to be what we've been seeing from Memorial Day weekend, from the 4th of July, from Halloween, all these big holidays that traditionally have a lot of drinking. People tend to say, oh, I had a couple and we figured what was the big deal. And then we found out that that's what happens. The other thing, and this is a personal hypothesis, there's just no data to back it up. When we are drinking, we tend to be telling jokes, laughing very forcefully. Sometimes
More aerosols.
Coughing, depending on if you're drinking and doing something else, whatever you're up to. So not only are we inching closer and closer, we're also arguably spitting on each other more because, as you just said, there are more aerosols. So limit the intake when you're with other people outside of your pod if you do choose to do something like that. So that's one thing. Let's then go to the winter sports. I have to say I am so excited it started snowing because I feel like I can finally get my kid outside to be social, and I understand that that's completely backwards in comparison to what everybody's saying, but hear me out, and it's for similar reasons you were saying. If there is snow outside, our kids, who I'm much more concerned about because the adults understand what's going on, so the adults are wearing their masks, the adults are staying apart. The kids are more likely to keep their masks on because their faces are cold. The kids are more likely to be wearing gloves, so they're not going to touch each other. The kids are so bundled up that they can't run as quickly toward each other, so you as a parent can step in and make sure that they don't, lick each other's faces or whatever.
Right.
I've just eagerly been awaiting for the snow for that reason. So I am happy to share that as soon as it started snowing out here, I started looking for people to do sledding play dates with. So the rules are masks still have to be on under the scarves or the headgear that you were talking about.
So the cloth masks that you would wear to go into a store or to go into the classroom, keep it under your balaclava or your scarf.
Yes, and part of that is, and this is kind of in line with that kind of drinking, laughing thing. Snow is fun. And for whatever reason, people always shout and scream in the snow.
Right.
Especially the kids. So I really want to make sure that that is still implemented. I also, particularly for the sake of the kids, especially the very small children, I wouldn't want to, this is going to sound bad, break the training that we put into this.
Right.
So, I, for whatever reason, I've had a very easy time with my daughter wearing a mask, but I'm also out in the boonies. But I know for many people, it's really hard to get your kid to keep that mask on. And daycares have been struggling with this, and schools have been struggling with this, and parents have been struggling with this. Are you suddenly going to say, oh no, there's snow out, don't worry about it? Are you going to undo all of that?
Right. So if there's other people around you, keep your mask on, period.
Period. Done.
Right.
Unless they're part of your household.
Your pod. Yeah.
So yes. Now that said, have a potty plan. So if we're if we're going to somebody else's house, I'm going to put a little portable potty in the trunk of my car for her. We're still not going into people's houses, even if it is cold outside. Bring your snacks, bring your thermos of hot chocolate, and if you get too cold, go home. So that's the concern that most people in my profession have right now with winter. So while I'm saying, yay, winter, we can all be outside and have something to do that actually keeps us all apart from each other because we're all bundled. On the other side, this is going to be the most severe winter when it comes to COVID and the most severe time because it is cold. It's really cold. People want to go inside. Nobody wants to just chat on their porch anymore. And we as a group need to fight that urge.
And if the kids are going sledding at a friend's steep backyard, nobody goes into the house to go to the bathroom.
Absolutely.
Pick a tree. Pee on the tree.
Pick a tree. My daughter has already been warned about yellow snow and not to eat it. So we like to prepare in this household. But yeah, that's exactly it. So
okay, so let me ask an annoying question, okay? Because I really I want to tease this apart because I know that somebody is probably thinking about this. So you're saying that 10 minutes is okay, and if say the kids are playing at Tom's backyard,
Hmm.
and there's a bathroom right next to the mudroom door,
Yeah.
and somebody wants to go pee. So like somebody's going to say, "Oh yeah, just walk. Why don't you know, it's just two doors, one next to the other. Do your business for 2 minutes, get out."
Hmm.
What's wrong with doing that?
So we were talking about 10 minutes in a store where arguably you're not touching all that much, or in what you are touching, nobody else has really touched. When you're talking about going into somebody's residence, we run into, there are no disinfecting protocols.
Mhm.
Even housekeeper, I know, people who do whatever they do for a living don't necessarily uphold their own home
Right.
standards. So you need to, and this isn't to say people are dirty and, you shouldn't trust any of them and say that all your friends are disgusting. What it is to say is there's no standard, there's no audit procedure. We do know that live virus has been found in semen and stool.
Mhm.
Don't know what's going on in that bathroom. And also, do you have to pee in a warm place so badly that you would risk bringing what you have into that person's household? It's a two-way street, right?
Right.
So
Right.
so going into Joe Schmo's house and saying, "Oh, you guys have been potted. That's great. I feel comfortable going into your house." Have you thought about how they feel about you going into their house? Because if
Well,
you are,
I don't want to go into their house,
no, and
but
that's,
I
and
want
I'm
to
not
make sure
saying
that my kids understand why we don't do that.
right. And a big part of it is, and this is going to be a very broad generalization, but just kind of a way to think about it, is if you have a friend who's saying, "What's the big deal? Let me just go in your house to pee real quick." How seriously are they taking everything else?
Right.
And that's not to say they're not. Maybe it is a true emergency, and normally they're very much locked down. But if, and using this 15-minute rule can be a little dangerous because you say, "Oh, yeah, like it was less than 15 minutes, it doesn't count." But if you do that regularly, you're increasing your risk.
Right.
And that's actually one of, we talked about maybe talking about vaccinations quickly. And that's one of the concerns moving into the vaccines is people are going to start getting vaccinated and say, "Oh, I'm vaccinated. This is great." But and just, go out and stop wearing masks and doing whatever they do. But the vaccine's 95% effective, which is fantastic. But you don't know if you're part of that 5%. Right now, we're
Oh,
all on lockdown and we have an alarming number of deaths, and the virus is mutating. And it looks like it's behaving the same way, but it's becoming more contagious, which is another reason not to go
how
into.
is it more contagious if it's behaving the same way? What is different?
So my understanding of what's different, and I'm safety, I'm not a virologist, but my understanding is that the crown clusters on the outside, the spike proteins, are actually closer together, so it's binding more readily with our mucous membranes.
So you need a smaller viral load
Exactly that.
to get sick.
Yes. So, and that even points out more to the fewer people we have in these stores, the fewer people who are breathing the same air as these essential workers, the better we're going to be. Um, we're specifically talking about Tompkins County. CMC is seeing, I think we have just under 30 deaths. We've got just under 300 active cases. We had nothing going on before.
Right.
And I know we're all tired and I know we're all fatigued. But the thing is, we're in our first wave, arguably, and hopefully we won't see a second. But we just did so well in the beginning. We need to maintain that momentum.
Yeah.
And it's really hard to, I think part of the fatigue comes with, "Oh, the vaccine's here. There's a light at the end of the tunnel."
Right.
But I personally
Also,
think we're still
isn't
looking
it
at a
true
year.
that once you get vaccinated, you are, if you're exposed, you're likely to not get sick, but you're still carrying the virus. You're just going to be asymptomatic.
Mm-hmm.
So you still can be like, you can still transmit the virus as much as you would if you were an asymptomatic non-vaccinated person, which happens a lot.
Yeah, and that's part of why, regardless, and I'm sure anybody at CMC will tell you this too, a lot of doctors and nurses are getting vaccinated right now. And actually, on my podcast, I'm starting to talk to some of those people who have been through their first vaccinations. They're still wearing masks, they're still social distancing, they're still staying at home with their pods, they're still doing telemedicine if they can. we're still doing this. I
Yeah,
personally think we're at the halfway point of this whole thing. So
really. So
on
we
my
have another 8, 9 months of,
well, as I told you before, on my end, I'm actually at exactly a year since I knew about this pandemic because my whole business crumbled in December 2019 because of what was going on in China. And I knew it was coming, just the safe,
hmm
because, part of what we do is make sure that situations don't get to the point where you have to be in a hospital. So the safety and preventative group of essential employees, we've been talking about this since December, January, but nobody
right.
likes an alarmist, right?
So
So
people didn't listen to you. And if they had and started doing things more carefully sooner, we could have saved a lot of deaths.
I don't think it has to do with me specifically. I think a lot of it has
Right. No,
to do with
you as in your
politics and
profession.
yes, but I mean, even if there was a recent article about Fauci moving the goalposts on how many people had to get vaccinated in order to mitigate what's going on. And what he was saying is the polls were showing only 50 to 60% of people would get vaccinated. So he said, oh, that's all we need to make sure that we get this under control. And then people started gaining more faith in the vaccine, and it was 70 to 80% of the people were willing to get vaccinated. He goes, well, 70 to 80% is going to be what we need. And
Right.
he talked about how, and there are two ways people approach this kind of stuff. One is the way I approach it, where I sound like a major downer, but I say, this is the information we have. We don't have enough, so we're going to err on the side of caution. This is what we need to do, and this is what we shouldn't do. Versus what Dr. Fauci did, which isn't necessarily wrong. It's just a different approach, which is, okay, so this is what we've got. Yeah, that's good. But then he doesn't give any more information until later when he gets more, which
hmm
I find frustrating. I
Got it.
think most people are smart enough to handle it, and the more information you have, the better choices you can make for yourself and others. Which is why I love doing these little podcasts with you.
Yeah.
You ask me really good questions.
So I have one last question that I want to talk about, and that is about walking uphill.
Yes.
So before the pandemic, I got myself to a place where I was finally enjoying going to the gym. I used to hate going to the gym, and then I found a gym I loved. Shout out to Journey Fitness. Now I don't go to a
Yep.
gym. I do all of my fitness myself, which is very hard to do. My favorite way of keeping in shape is going for steep walks. I live in Cayuga Heights, which is just uphill from Ithaca High School,
Mm-hmm.
and it's at the top of a very steep hill. So going downhill and then climbing all the way back up has been my most readily available, get your heart rate pumping, work your body way to go. And much of the time I do this on my own, but I love going for walks with friends. Um, when I go for when I'm on the steep part of the hill, I actually find that it's hard for me to keep my mask on. This is, it's like running on the treadmill, and I breathe, it's hard breathing. So what I've been doing is that if I'm alone, I usually, pull my mask down to my neck.
Mm-hmm.
And if I'm with a friend, which happens about once a week, I will, ask their permission to pull my mask down, and then we will walk about 6 to 10 feet apart from each other. So first of all, does it make a difference if we are walking parallel to each other when we're 6 to 8 feet apart from each other,
Mm-hmm.
or if we're behind each other? And so you actually end up walking through the air that your friend just walked through. Is that enough of a viral load to worry about? Is this even okay? Because I'm guilty of doing this. This is something that I have been doing. I've been asking, when we get to the steep part, I want to take my mask off.
Right.
So how can I do this? Can I do this, or should I just be going for walks alone? And what's the safest way?
Oh, the reason I'm kind of laughing is you're getting into emergency response. So I'm going to give you a long-winded version of an answer
I'll
because
take it.
you can be informed. So there is this wonderful book that we lovingly call the Orange Book. It's called the ERG, which is the Emergency Response Guide, and every first responder, particularly your fire department hazmat team, is going to have this in their truck. And what it is it lists the UN number of chemicals, so those numbers you see on the side of delivery trucks, the chemical type, any kind of first aid measures, and then how far away you need to be from the spill depending on how big the spill is.
Mm-hmm.
And there's always a section that says if you're upwind or if you're downwind.
Mm-hmm.
So of course, if you're downwind, you have to be a lot further away. Usually it's 1.5 times the amount. If you're
Mm-hmm.
upwind, you can be a little closer because the wind's blowing the hazard away. So if we're going off of general ERG type guidelines, and especially because it's novel, I would say 2 times the distance. So if New York State is saying 6 feet, I would say you should be 12 feet away. Now again, this is according to the CDC, 6 feet with masks. If you look in Europe, they're saying, I think they're saying 3 meters. Some people are saying 12 feet in the States. It kind of varies. So it's whatever you would normally do, whatever your guidance is telling you to do. I would say times 2, especially if the wind is blowing toward you or you're upwind. Now, that said, we're talking about exercise, which means we're spewing more aerosols out, which kind of gets into that drinking and laughing. It gets into that, everything, all the reasons that gyms have been closed. It's all the same stuff. However, we are outside, so your viral load's going to be far more dilute because we're not recirculating the same air and you're not going to be exposed to that same breath. So the question I pose to anybody with the same question who's been with us for the full hour is, if you were called the next day and your friend that you were with said, I just got a positive COVID test, would you be confident that you are safe, or would you be concerned? And
Right.
that's the type of analysis that we need to be doing. So on my end, if it's an option to walk alone, I would rather do that. If I'm walking with a friend, I would do minimum of 6 feet with masks on, likely side by side, because you don't want to walk through that plume.
Plume, I love that word.
Plume. Yeah, sorry, that's the chemical safety. So yeah, that's really the question. And a great illustration of this is I had a client that I wrote a COVID protocol for, and they called me just freaking out. They had just been called by a patient that came in the day before, and the patient said, I went through my routine work testing and I got a positive result. And my client calls me just freaking out. What do we do? Do we close? Do we do this? And I know that this client has been following the protocol I wrote just to the T and added their own stuff. Just amazing, amazing, amazing. So I advise them, close for the rest of the day. It happened to be Friday. So close for the day, do your disinfect and clean per your protocol, and then let's call the contact tracers just to say, here's our protocol. This is what we did. What more do we need to do? And the story is that she called the contact tracer, said what field of work they're in, and the contact tracer looked up their website and said, the chairs are kind of close together. This industry, you're probably gonna have to close for 14 days given what we know of the industry. And she goes, oh, no. We have a written protocol. This is our protocol, and this is everything that's changed.
And the pictures on the website are from before COVID, but right now the distance between the chairs is this much.
Yeah. And the contact tracer says, all right, let me talk to my supervisor. I'll call you back. And she gets the call back, and they say, we've not seen anything like this for this industry. You can open again on Monday. We have no reason to suspect anybody in your facility has been exposed. We're not going to contact trace any of your clients. You guys are good to go.
That's amazing.
And then it was just such a sigh of relief. But, just because the contact tracer said it was okay doesn't mean we didn't still have the employee who treated that client. They still had to get 2 negative tests just to rule out exposure with, just everything within the guidelines of what was already written. We still followed it, even though the health department said we didn't have to, because nobody wants to be in that position.
Right.
So when she called me, the first question was, did you follow the protocol? And I know the answer was yes. I had no question that this was going to be a non-issue. And that's what I pose to everybody else out there is the information's out there. What you need to ask yourself is, the next day, if you were to get that call, would you be confident? And if you're not sure, call me or call the health department, because that means there's a question you have that you don't know the answer to. But yeah, so in case of of walking up and down hill with a friend, I would say I would ideally go 10 feet apart, masks on, is the
Mhm.
long, or the answer I'm trying to get to.
Right.
But that's what I'm comfortable with because that's the information I have.
Got it. Okay. I just had one more question that came up when you said two negative tests. Do we have time for this, or should we save this for next week when we're on the call with Samantha?
Go for it.
Okay, so I understand that if somebody, okay, I have a kid. One of my children's friends was was sick 2 weeks ago,
Mm-hmm.
and now the question is, if should I let my child go sledding in a group that includes that child?
Were they
Um,
sick with COVID?
yeah, so they were sick. And then there's another friend that just got back from visiting family in Massachusetts, right? And like, yes, they're gonna they got tested when they got back, but I don't think that they've had two negative tests. So at this point, I don't feel comfortable letting my child even go sledding with people that I know have been sick or that I know have been traveling. So I'm assuming that they could very well be exposed, especially if they were on an airplane. So when would it, I mean, I'm very risk averse and I want to say, okay, a full month before you get to see your friend outdoors with masks again.
Right.
But it's a close friend and he really would like to see him. Where is it my anxiety that's taking over, and what would you do in a case like that?
If someone has a known positive COVID test, I would absolutely not get together with them, regardless of what you're putting in place, because we're talking about the hierarchy of controls, and it's personal protective equipment, administrative controls, engineering controls, and then substitution, which would be something like a Zoom plate, and then elimination, which is eliminating the hazard altogether. If you know that there's a hazard and this person has COVID, I would eliminate the meeting until you're confident that they don't have
So,
COVID
so
anymore.
how do I know that they're confident? So, like, if they've had two negative tests since they were sick, is that okay again?
I'm a proponent of the two negative tests. So the tests uh, the tests tend to be, I want to say they were 85 to 90% accurate. I think we're closer to 90 to 95% accurate now. So just for the sake of argument, if we've got 90% accuracy, and then you take another test that's also 90%
Right.
accurate,
The
your combined
overlap
is
is
going to
pretty
be about
good.
95%. So there's still a non-vanishing chance that this person still has COVID, but they would have also gone through all the symptoms already. And what the guidance seems to be is that once you're asymptomatic, it's highly unlikely you're going to be contagious. In the podcast series that I've got, a bunch of COVID survivors, their doctors told them not to bother getting another test after they were done with their symptoms. So they had COVID, they were positive for COVID. They went through all their symptoms. They went usually 72 hours without any symptoms. And in every single case, the COVID survivors said, my doctor told me not to bother getting another test.
That is so weird because we also hear about people who've had COVID who then have long lingering symptoms. So they don't have a fever anymore. Maybe they're not sneezing or coughing, but they still have headaches.
Yep.
So if they have headaches, does that mean that they still have COVID and they're still contagious? Where, like, that doesn't make any sense to me. And that
So
brings me back to, how when, President Trump was sick and then less than a week after he was already being seen in meetings.
right.
So I was like, if for a person who just tested positive, it's a 14-day quarantine.
Mm-hmm.
How come someone who was sick can see people after 7 days?
I can't necessarily speak to President Trump or any of his
None
decisions,
of us can really, but
but uh, I'm going to use one of my other podcasts as an example. Let's see, it was recorded in October, and I interviewed her on day 182 of having COVID. She, 182 days later, still cannot taste or smell.
oh wow.
Her husband and child both had COVID, and since, don't have it. And she's She's been able to go out and about. So that viral shedding, we know, tends to happen before the onset of symptoms, which is why this is such a screwed up virus, because
Right.
you won't even know that you're sick and be transmitting it. And then once you do know if you're sick, or do know that you're sick because you're symptomatic or because you went through routine testing, it's already too late. Kind of like that E.
Right.
coli thing. Just because there was a recall doesn't mean you're safe. It means now you know that that stomach ache was E. coli.
Right.
So that's part of the problem. That's part of why we have to be so cautious, and that's part of why there are podcasts and YouTube videos and doctors just like pleading with people to just hang on a little longer, and even if you get vaccinated, continue hanging on until everybody can get vaccinated. Everybody who wants to get vaccinated can get vaccinated.
Yeah. So the bottom line, though, with the friend, if the friend tested positive, if the friend tested negative twice after
I'm
they were sick,
I'm
then they're like every other friend in the friend group,
mm-hmm.
basically. And
And that's,
still keep your distance
yeah,
and everything. But otherwise, I just wouldn't allow the child.
it's a risk not worth taking.
Yeah.
We're
Okay. Zoom, baby.
Zoom baby. Yeah, we're 9 months into lockdown, going on 10. Would you really throw it all away?
Nope. No, I won't.
And that's kind of the plea I've had, at least starting in December. That's my plea is, would you really throw it all away, guys? Like,
Right.
just hang on there. It makes absolutely zero sense to me to get in touch with a known risk despite everything we're doing, because we're doing all of this because we don't know the risk.
Right.
Why
Exactly.
would you do this and actually know the risk?
Okay.
So yeah.
So thank you so much. We've been a little bit over an hour. I really appreciate your time, attention, and detailed responses and very thoughtful answers. It's been a privilege and a pleasure to be able to ask you all of my weird questions, the way my brain works, and just like, but what do you think about this way? I am hoping that our listeners have found this as useful as I have. And let's all just hang in there. We are going to talk again next week with Samantha Hilson from the Tompkins County Health Department, another three-way Mama's Comfort Camp team members talking. I'm looking forward to that. Where can people find you, Sam?
People can find me at absoluteehs.com. EHS stands for Environmental Health and Safety, absoluteehs.com. You can always reach out to me through Mama's Comfort Camp. I am one of the moderators, so I diligently read just about every single post.
Thank you for that.
But also my phone number is out there. Please remember I have a kid at home, but you can call or text. It is on my website. I will say it, 917-861-9405.
Did you used to live in New York City?
Oh man, I'm Brooklyn baby. Yeah.
Okay, cool. I
I'm
lived in
so
New York
cool.
before. Oh, I have so much more to talk to you about, but we should stop. We should get off the phone, get off the Zoom. It's so lovely to see you. Hang in there, everyone. Keep your head above water.
And thanks for letting us record your line of questions. I'm sure it's very helpful to many people.
Thank you, my dear.
All right.
Okay.